Hello, everyone. Thank you so much for helping out. Um, if you're meeting me for the first time, my name is Ransom Nyema. I'm a medical student studying medical radiography, and I'm in my fourth year. And apart from my studies, I'm also a top-rated medical writer. I write medical blog content. I write medical articles. And I write social media blog content as well. And I also own YouTube. So today I have an amazing guest speaker all the way from the United States of America. Hey, Dr. DeRouen, could you introduce yourself to the audience?
Thank you so much for having me. I'm so excited to chat with you. And I'm so proud that you are in your fourth year of medical training. So that is amazing. So kudos to you. My name is Dr. Erkeda DeRouen. I am a multifaceted physician. I am a family physician who's also board certified in lifestyle medicine and diversity medicine. And I am a physician executive in the digital health space. So I am the chief medical officer of an organization called Emme that's working to empower women with their birth control digitally. And I also have a digital risk management consulting firm. So that is a mouthful. And what that is digital risk compliance solutions. We help healthcare organizations devoted to digital health excellence intelligently navigate risk by minimizing their risk of being linked to non-compliance and under-optimized workflows.
Amazing. You're a multifaceted medical doctor, right? You do a lot of things, to offer a lot of services, which is amazing. So before I move further, because we got a couple of questions for you to answer, I hope you're ready, right?
I'm ready.
So before I ask you those questions, you know, in a nutshell, being a medical personnel or a physician or whatever medical specialty, you know, it comes with its workloads, as a medical professional. So in terms of your own case right now, you do a lot of things, right? A lot of things. So tell us, how do you find time to do all those things while being a medical doctor? Tell us.
So I think that it's all about your journey. So there are different phases in life. So originally, when I first started in family medicine, I thought that I would work in a clinic for 30 years, just caring for patients who were medically underserved, and they are near and dear to my heart. But then I discovered digital health, and it was before the pandemic, before it was very popular. And I realized that we can impact patients from a higher level, just working to impact systems. So I grew in different phases of leadership. And now I'm only seeing patients one day a week. So it gives me time to do other things to impact um, populations as a whole and build up the system. So I think that people who may be looking, who may be in their stage of training, it's okay to think outside the box. It's okay to try other interests, because a lot of times when you're in training, a lot of the people who train you, and it's not any like malintention, I'm sure, on their part, but you only really learn about like being in the hospital or being in the clinic, and there's a lot more that you can do with your gifts to impact people and to help them, just like you're doing right now by also doing your medical writing.
Hmm. Wow. Thank you so much for sharing that, Dr. DeRouen, right?
Yes.
Oh my goodness. I'm so sorry if I'm not pronouncing your name correctly. All right. So like I said before, we have a couple of questions for you to answer for the audience to get more enlightened about, the kind of services you offer to the table. So if I'm looking downwards, I'm reading the questions to Dr. DeRowan. for her to share own narratives of these questions, so that you guys be wondering why I'm always looking downwards, right? So the first question for you goes this way. So what are the most common compliance, issues in healthcare organizations that oh, hold on a minute.
Mhm.
Before I move further to this question for you, did you say you're a family medicine medical
Yes,
personnel? All
yes.
right. So to get the question right for you, so the first question goes this way: what are the most common compliance issues healthcare organizations face when migrating to healthcare solutions? What are your thoughts on that?
So I think that is multifaceted because compliance is complex, and there are different facets of compliance. So there's compliance due to certain laws in the clinical realm, certain quality metrics, certain so it's a very complex question. But when you're thinking about digital health in that space that we're doing, because nowadays every healthcare organization is a digital health organization. Initially, we were thinking more startups, but now we're seeing we're implementing telehealth and other digital solutions in hospitals, in urgent cares, in other facilities, even like nursing homes. So every healthcare organization in this realm or era is a digital health organization. So you have to figure out how to be compliant in that realm. And we have, the legal teams, the risk management teams, the compliance teams, but are they enabling you for this era and these rules? So big things that I liked for us to think about are four things. So major things are data protection and privacy. So ensuring that the patient data is handled accordingly to different rules like HIPAA and other relevant regulations. So examples as to where there were some failures in this and why we have to have a closer eye is recently we've seen with Change Healthcare, those who have been following the news, there was a ransomware where basically people came, they kind of took over the system, and this was the largest healthcare cyber attack in history. And it's already cost over these past 6 months or so, like over $800 million. So it's huge, and it's causing issues with hospitals and with care providers where they're not able to be compensated because this is an insurance company who reimburses here in the US money. So people aren't on the verge of needing to get loans and all of these things just to keep their clinic afloat so that they can care for patients. So that's a huge thing, like protecting privacy. Another thing that people, organizations in the news have been fined for would be GoodRx and BetterHelp and others for violating the health breach notification rule, where they share data with sites like Meta and Pinterest for humans doing intake forms. And they said they wouldn't share, but they shared it. And people were kind of, if you go on a site like Hims and Hers, where men may go and for hair loss, and then they're getting ads for hair loss things, like how does the internet know that? So you have to think about life in the digital age and how to protect patients and their privacy, because before there wasn't a lot of scrutiny in digital health, but now the eyes are there and they're creating laws and they're following up on them in order to make sure that we're protecting patients. Another thing you think about is integration challenges. So how do you properly integrate new systems with existing ones if we're creating these digital solutions? There are people who use wearable devices like the Apple Watch and other more popular things, or blood pressure cuffs and stuff, and they want to transmit that information. So how do you ensure that you can share it, that is reliable, that is valid, that there aren't any potentials for breaches, and that is interoperable? So there is a lot of talk between different systems and making sure that they can communicate and you can get the information. The third thing is kind of failing to stay up to date with these new regulations. As we've mentioned, the landscape is evolving rapidly. So your team must be aware of how and what and when these things are happening. And you can't do it just when you're hearing something in the news, because it could be you. So being aware, having teams that come together so that they can update workflows, product protocols, systems in real time, as well as train the users who are using it, and keeping them up to date. So the fourth thing is user error. If your team doesn't know the updates, or they're not properly trained on how to utilize something, or we do a HIPAA training where they just have to click that they've read an SOP, they're not going to retain it. So making sure that we have users that are properly trained and it's according to their learning styles, so that they can comply with the new systems that are coming up and the protocols and the regulations.
Wow. So that was an amazing answer to that question, and I believe that the audience will greatly adore you for that. So before I move to the second question, um, so in a nutshell about what you just said, you stated about cybersecurity in the healthcare system. It's really important because when I had a one of my past guest speakers in my YouTube. She's a pharmacy. She a Nigerian American, but she owns her own pharmacy in the U.S. So we talked about insurance and all the things, and it was she talked narrated how hectic it is to get all this insurance stuff, and insurance being hacked by terrible people out there is really terrible. So I think um, in general, people should look more into the cybersecurity, for them get bring more people to, join into cybersecurity to put more, efforts in curbing all this, cyber crimes happening in the healthcare system. So thank you so much for sharing that with us.
Absolutely. And I agree that we have to secure our systems.
Yeah, sure, sure. So the more people, the groom in cybersecurity, the more, you know, all hands on deck to solve that problem as well. So the same question goes this way. Wait, hold on. You talked about a watch that can serve like a thermometer, right?
Not necessarily. I was talking about two different things, but there are a lot of opportunities for interventions and assessments and evaluating patients from their own home utilizing different technologies. So, for instance, the Apple Watch or a Fitbit can showcase like your heart rhythm and how you're walking, and you can transmit some of that information if the systems are in alignment, or if you're measuring some blood pressure with a blood pressure cuff that is smart and digital. Sometimes it can upload that to different systems if they speak to each other. And that way you can reduce the amount of visits you need in person to check it, or you can have a better record of what's going on with the patient when you do follow up with them, because you're seeing it over time and you're able to trend it, as opposed to asking a patient to come in when you're following up with their blood pressure and remember to document and take it a couple of times a week, and if they forgot or they make up numbers, or maybe even unintentionally they don't understand what those numbers are, and that's a whole nother conversation about health literacy. But
Yeah.
make sure that they understand and you're able to get reliable numbers.
All right. Thank you so much for sharing that with us, Dr. DeRouen. So the same question for you goes this way. So how can healthcare organizations, identify and monitor the importance of efficiency in digital healthcare? What are your thoughts on that?
I feel as though efficiency is very important. It's what helps keep your organization running. It's what allows you to have more time to see more patients and to get to the point of profitability. But on the flip side, patient safety and employee satisfaction is also very important. So while we have this technological advancement, we must ensure that we have a human centric approach to care. So we have to utilize tech to help decrease these administrative burdens, but don't pile on too much on your workers and your employees to the point where there's an overload in your workers. For example, there can be different organizations that may be text-based, where you can text your doctor. So that is utilizing some things to help become more efficient. And just like you can text on a phone for regular life, some organizations do allow that. So where while you're optimizing this efficiency and allowing people to text maybe more than one person, like I could text you a question and then someone else is texting me and I can text them that. But where do you draw the line? Should you have clinicians texting 5, 10 patients at once? That may not be a good idea, even though they can do it and it can improve efficiency. It may cause other things that may make it more likely that you may come into errors, which can have a potentially poor outcome for your patients. And then, like you may text the wrong medication or text the wrong patient their name, which is identifying certain data and HIPAA protections and stuff. And then on top of that, like we talk a lot about burnout and employee satisfaction and engagement, making sure that your efficiency pushes aren't necessarily causing harm and moral injury to your workers. So there's that fine balance. Some things that you can do to just make sure that you are working on the efficiency and things is to like regularly track and analyze the key performance indicators or KPIs, like patient wait times and treatment times, or what kinds of resources that the patients as well as the workers are needing. You can work on continuous quality improvement processes, so monitoring and enhancing the efficiency, like by looking at the data and seeing like what you're doing, what outcomes are coming, what issues are coming about, and having peer reviews to go through that and working through it in a systematic way, and also making sure that you're overlining things that kind of coincide with risk management. Like if you do this, what happens? If you don't have this feature, what could the potential outcome be? And looking at what's been happening in your actual organization is very important. Obtaining patient as well as your staff feedback is very important, because those are the people who are using the systems every day and they're the closest to it. So you can have this kind of bird's eye, like big view of what you intend to happen, why you bought the certain programs and why you're using certain resources and all of those things. But you have to keep the people who are doing the work in alignment and get feedback from them so that you can implement certain changes that can help your efficiency. So you may be thinking like, oh, this will really help them with their workflows. And then you talk to 10 employees and they're like, that's a terrible idea. This is what helps me, and this is my little secret and trick to do these things. So getting that feedback is very important. You can also, in order to help efficiencies, kind of employ certain things like digital dashboards and analytics tools where you can have real-time monitoring and reporting. So you can kind of pinpoint certain red flags like, oh, we've been doing good for this week, and then right here, there was a drop in patient times. What was different? Oh, we employed this new certain tool and it's helping. And that kind of goes along with conducting regular audits and assessments to ensure that your processes are streamlined and efficient and effective.
Amazing, Dr. DeRouen, right? So, wait, there's something you talked about that made me a little curious about something. You know, we the med students are always very curious about something. So I'm so sorry if I'm curious about that question. So you mentioned about like a medical personnel like not being able to answering, texting or answering questions from the patient through texting, right? So my curiosity came in when I remembered something. So that thing I remembered is, do you think that AI can solve that problem?
I think AI has already been working on that problem. AI isn't new, it's been around forever, but we're just talking about it in a different way and it has a different like headline. So AI, machine learning, those kinds of things can offer interventions to help with improving efficiencies, asking appropriate questions, but we also need to think about the balance of incorporating the humanism in medicine and having that human oversight. There are also rules and regulations in which physicians or nurse practitioners or physician assistants, they have to engage with the patient. There are some rules, at least in the United States, where certain states only allow video visits versus some allowing phone visits or allowing the text-based things, or a mix of the two where there has to be a certain amount that are video. So there are different rules, and only a human can prescribe certain things. So you need that oversight. So it's a balance. So I think that some organizations have been using AI. I think that they're going to evolve in the manner they use it, and then the techniques that AI is getting smarter and smarter each day. We've seen, even with like ChatGPT over the last 2 years, how much it's grown with each new edition. So I think that there will be more AI enabled assistance for healthcare organizations to become more efficient, to help go and look through inboxes. We've seen that with Kaiser, where they are having these things to kind of help alleviate some of the administrative burdens that healthcare clinicians are facing in order for them to care for their patients and work at the highest point of their level. So technology can be good and it can help, but we have to balance that with the humanism and oversight, because the human is still going to have to go and double check and make sure that things are going well with the recommendations for the patient. And you may need humans to talk to a patient. Say someone is coming in for depression. Yes, we've seen that some of the studies are showing that the AI may be winning in some of the empathy statements that they're giving patients, but we still need that human assessment. So it'll be very interesting to see what adaptations we adapt over time, and how we utilize these mechanisms like AI to help as an adjunct to human care.
Wow. Thank you so much for sharing that with us, Doctor. So before I ask you the third question, in your own perspective, do you think that, yeah, it's cool that human connection is really a very important thing for a patient, right?
Mm-hmm.
Because the first year radiography student, on my clinical rotation, right? So I've
Mm-hmm.
met a lot of patients, like really a lot of patients, done a lot of positionings, for the chest X-ray, the lumbar spine X-ray, the femur, the ankle, the foot. I've done all those things, and before you proceed to all those radiological examinations, you have to have interaction with the patient. So that's when one of my courses I did in my second year, psychology and radiography, comes in, how to interrogate with the patient. So apart from the human connection, in your own perspective, do you think that AI is going to take over healthcare system in the nearest future?
That's a great question. I do not. I am a proponent for utilizing AI. We've definitely seen, and I think that radiology is one of the first fields that fully immersed into AI. And it helps. Like, it helps spot extra things. It helps with different views, but we still need that human touch. AI is definitely helping, and in the headlines for most organizations here recently, the White House in the U.S. released a policy on AI governance, innovation, and risk management, which I think is phenomenal, because it's causing healthcare organizations and other organizations throughout the US that aren't even just in healthcare to look closer at how they are navigating the AI. So it's not just like the wild, wild west. So how are you ensuring that there's quality with these systems, that the vendors that you use are reliable and trustworthy, and they have the patient's best interest at heart, that you are not perpetuating bias or decreasing the safety, so that you can improve outcomes, and that you are having, and that's a part of it, this human oversight. So you're not just letting it run rampantly. So I am so excited about AI and so excited about the promise and the new tools that will come and the initiatives that will come, because they're forming these oversight boards and these coalitions where all of these thought leaders are coming together for the greater good. And it's not just, let's push our company to be the best and let's steal all these, like they are sharing information and they're having this oversight, and they have certain deadlines in which they have to implement certain things. So right now it's happening more so at the federal level, the highest level of our government, but it's everything that happens there trickles down into healthcare. So we're seeing that organizations like our Health and Human Services, which oversees a lot of things in healthcare, have come out with a plan. So now it'll be interesting to see when it gets to that local level, what comes of this and how organizations will be held accountable for the AI utilization that they're doing, and how will they work to mitigate these risks. So I love in the title, it's what we need, that they even thought about like governance, yes, the oversight, the body, the planning, innovation, yes, because we want to push healthcare forward and we want to continue to innovate. We don't want to stifle innovation by oversight. We want to make sure that we can innovate responsibly. And then how do you responsibly do that? Risk management. So I love it. And I'm so excited to see maybe if we follow up in the next year, what new innovations will be there.
That really comes into my other work as a medical writer. You
Mm-hmm.
know, AI is there, right? Like you mentioned about ChatGPT, right?
Mm-hmm.
I, I try to use my own platform to tell people that AI is not there to, overthrow with writers, but it's just there like to help, to
Yes.
just improve, our capabilities, right? Because there are some times I face writer's blocks. Like what that means is imposter syndrome. I can't really figure out what to do next, or what to put in, or like what to rhyme or something like that. That's when you have to consult. I take AI like a consultant, like a
Mm-hmm.
cancer need problems. Just go over there and just give you some strategies to adhere on. So AI is just there to improve, not to take over. Thank you so much for sharing that with
I,
us, Doctor.
I completely agree with that. And then even with that, AI is only as smart as the person who's using it. So, say you're using it to brainstorm on a very basic topic. If you put in a very basic question, it's going to give you a very basic answer or very broad. So, you're utilizing your knowledge to kind of tweak how you even ask the questions to formulate what you want to do. So that's just at the most basic level of maybe even writing. But
Yeah,
you're utilizing it for patient care or for healthcare technologies, that also translates because it's as smart as you are. So if you have things that are biases or these different things that are may not be good for patients, and you're programming it with that lens, that's the type of product you have. So that's why it's also exciting to have this oversight and this human things to make sure that we aren't programming in disparities and other things that may not be good.
yeah, amazing. Before I move to that third question, AI is programmed, by a human, right?
Mhm.
Yeah, I've been writing since my first year in radiography school, um, since 2020. So I've had like 4 years of experience in medical writing. So, and I still do a lot of mistakes. And there are people that have over 30 years of experience. I mean, not even only the medical writers, even medical doctors. Like I had a rheologist on my YouTube channel. She has over 30 years of practice in rheology, and she still make mistakes.
Mhm.
No one perfect. So everything about human is not 100%, right? Even AI is programmed like by human. So there are some mistakes AI can do. So that's why I tell people, especially the writers, don't rely fully on AI. So just try to use your own knowledge and mixture with the AI. So I believe that's cool, right?
Yes.
So that third question goes this way. Hmm. It's a bit tricky. Are you ready for that question?
Mhm.
All right.
Right.
Mm. Okay. So, what strategies would you recommend to reduce finances risks, associated with the use of new health technologies? What are
Mhm.
your thoughts on that?
I think that it's something that organizations have to keep to the front of their mind. Of course, we want to decrease patient risk first and foremost because patients come first and the risk of a life is the most important. So make sure that you're assessing technologies to ensure that you are not putting patients at risk. But the other component is financial risk because if you choose the wrong system or the wrong program or your workflows aren't optimized or you're overworking your employees to the point where you are having high turnover rates, these are financial risks that could put your organization at risk. And then in a larger perspective, if you have a detrimental error or systems failure, this could lead to certain fines for your organization by the regulatory bodies, through lawsuits from the patients. There are so many financial risks because healthcare is a risky business. So, in order to ensure that you are mitigating some of these financial risks and navigating them responsibly, you, especially with the utilization of new health technologies, you want to make sure that you're doing your research, thorough market research, ensuring that the technology aligns with the needs and that there is a potential ROI, but also making sure that you're assessing these vendors to make sure that they are reliable, that there will be support, that they are not, that they are in compliance with all of the regulations that may come from certain regulatory bodies like the FDA, like when you're utilizing wearable devices, like are they safe? Are they reliable? Do they have accurate outcomes? Will they have data safety and security associated with them if you're connecting them with your systems? Because you're only as strong as your vendors that you partner with. So those partnerships are a reflection of you. So you have to do a careful selection of your vendors and who you're utilizing, making sure like you evaluate their use cases and things like that. It's maybe a good idea to start in order to decrease the risk by starting small, like a pilot program where you can run an initial small scale implementation and then utilize risk management strategies in order to assess, in order to do quality review, in order to see how it's working with the patient and how your staff is reacting to it, and then give that feedback to your vendors to see if that they can customize things according to your needs, making sure that you are regularly doing and updating the risk management plans in order to see if there are emerging issues or changes that need to come, especially with all of the rapidly changing regulations. You have to make sure that your new technologies are keeping up and that they don't negatively impact your patient safety or the human rights or the equity. And then you also want to make sure that your staff is appropriately trained. So making sure that you have this robust training so that you can reduce these human errors or inefficiencies so that you can optimize your investment.
Wow, that was an amazing strategy you recommended right there. To reduce financial risks associated with the use of newly health technologies. So this question is kind of like acquainted to the first question about what we talked about
Mhm.
insurance, right? So we have three more insights about cybersecurity. Cybersecurity should be more, prevalent in terms of the healthcare system, to provide proper protection over the data analytics, in the healthcare system. So thank you so much for sharing that nugget you dropped right there. Thank you so much.
Thanks.
So the first question, the fourth question goes this way. Hmm. Hold on a minute.
Mhm.
Before I ask that fourth question,
Yes.
apart from the US, have you been to other countries before?
Mhm.
Could you just mention the country you've been?
I've been to a few countries. I've been to the UK. I've been to Colombia, South America, throughout there. I've been to Canada. I've been to a few. Yes.
Yeah, the reason why I asked you that question uh, is an amazing stuff that you've been to all these countries, right? So, what do
Mhm.
you have? Before I ask that first question, what is your take on the healthcare system in the U.S. with other countries you've been in your own perspective? What do you have to say for that?
That's a complicated question because it's a little disappointing. The US is one of the most industrialized countries in the world, and out of the major industrialized countries, we're the only healthcare system that doesn't have a form of universal healthcare. So it is embarrassing a little bit because we don't have a safety net to ensure that everyone who lives in the US has the capabilities to attain care that we need. Now, looking at other nations' healthcare systems, no, nothing's perfect. So we can't say that one system is doing it the best and all of these types of things. US spends the most money on healthcare, and we have some of the lowest life expectancies. Our life expectancies actually dropped during the pandemic. So why are we spending so much money but not having the great outcomes? And I think that some of that is due to the structure of our system. There are some systems that have full, like universal health care, everyone gets the same care. There are some health systems where there's a base of like the national health care, and then people can privatize medicine. There's a mix of different things, but I think that we need to start somewhere. We had made some improvements when we had the Affordable Care Act a little over a decade ago, where more people do have access to care, but we can see that that's not enough. Like before I entered digital health, I worked at community health centers, and in my health center, 50% of my patients were undocumented or uninsured. And just seeing the lives, that the way that they had to navigate the health care system just because they didn't have insurance wasn't right. I had a patient, lovely male from Mexico, who was so sweet. I've talked about him in my TEDx talk. For those who may be watching, I have a TEDx talk called "Did Disney Just Save Healthcare? Imagine That." And it talks about this man who had some blood pressure issues. Eventually, that led to some kidney problems. We were following it. And over the years, he ended up developing kidney failure because he didn't have insurance. We had to go and talk all about and try to get him help to see a kidney doctor, a nephrologist. And when he went to see them, they recommended that he get dialysis. And instead of being able to go to a dialysis center that a lot of patients here in the US use to get their dialysis care, that's a whole nother story because a lot of countries have home dialysis, which is better and more patient centric. But here we make them go to the center and sit there for days, and it's not the best. But instead of being able to go there, he had to go to the emergency room every 3 days, which caused astronomical bills, and it was not good for the system. So we have a ways to go with improving our healthcare system. Some of these digital health organizations are providing care for patients who may not have been able to get it other places. But we also have to recognize that, especially in digital health organizations that are not tied to in-person care, it is wonderful, but it should be used as an adjunct to patient care because there are certain things that patients need to be seen in person for. So it's not a replacement, but it's a tool and an asset. So we have to figure out ways in which we can push forward and put the politics aside here in the US and put human health and dignity first. But that's my soapbox on that.
Yeah, that was an amazing narratives you dropped right there. Thank you so much for sharing that with us. Easy. You know already. We met students. We ask questions a lot. So
Mhm.
I'm gonna ask you a question. Another question is coming up. Just is a mixture. So
Mhm.
that's just both question. Are you ready?
Yes.
So can you give me examples of success in digital health, reducing operating losses and improving compliance? So what is your thoughts on that?
So I feel as though there are literally thousands of digital health examples where you are reducing costs and having ways that you can reduce the operating costs of being in person. Like there are companies that are popping up literally every day. And they're not just telehealth, like there are other things like we mentioned, like wearable devices and remote monitoring. So I'll give a few examples. So telehealth programs, they can reduce the need for in-person visits. They cut down on the overhead costs and they also improve access to care, not only for those who can attain the care of coming in online, but also for those who may not have been able to get in person, who they may need an abdominal exam, they may need someone to drain a boil or something like that. They have more access to get that higher level of care because those opportunities where a patient can be seen virtually open up space. So there are also these AI driven predictive analytics, like you were talking about, where it helps to optimize the resource allocation, and it there are also things like the digital therapeutics and personalized precision medicine where it can help reduce these costs of trying medicine after medicine and that guesswork and the practice and the art of medicine, and kind of help patients find their right treatment plans for specific patients like quicker. There are also these remote monitoring tools where you can kind of work on your chronic care management, or you can see patients like if you are in this or a ICU doctor where you have been able to have care in a rural hospital or something like that, they can oversee that. Or you have these you can help patients with heart failure and you're using these remote monitoring where you're getting their weights to them and electronically and stuff like that, that can help reduce hospital readmissions. And then in terms of compliance, like things like my organization, Digital Risk Compliance Solutions, we have tools where we can help organizations navigate risk intelligently, along with experts that also know that clinical side of medicine, that can allow for the optimization of workflows and digitization of that risk management and that compliance piece to kind of take that stress over worrying about, oh, what's the legal regulation, where your lawyers are worrying about that, and then they're worrying about like your contracts and employees. Like we can kind of take that part away from you to kind of help you with that risk management and navigation.
Thank you so much for sharing that. So, what do you think is the role of employee training, in achieving digital health in your own personality, perspective? What do you have to say about that question?
It's essential. I think that training should be one of the major focuses of all organizations because number one, it can ensure that all of your staff is proficient in using the tools and the technologies. It helps maintain the standard of practice and the standard of care, and it helps improve patient safety. It reduces the likelihood of errors and also like falling into that non-compliance component of regulatory like requirements. Like all of your staff should know when there are changes and there are updates, and it shouldn't just come through in an email or just clicking by reading an SOP. It helps your employees feel more engaged, like they are a part of the team, like they know what's going on, like they're not just going with the flow. And it helps provide ongoing education practices when there are these updates and keep them up to date with the newest and latest things. So like when tools come out, you got to ensure that you're training, you're telling patients why. Because just like you mentioned that you're very curious and you wonder why. People in healthcare are curious. They want to know why they're doing the things that they're doing. So it's very important that you tell them. For example, I don't know if you've heard, but in the news in the past month or two, there was Kaiser in San Francisco implemented changes to their workflows where they're utilizing AI to help with certain things. And the nurses were very upset because they were concerned about patient safety, quality, as well as there is a risk for them like losing their job. So they actually picketed. They went on, they had a demonstration. And I think that that was a mistake on their part just because AI is wonderful. Like we've talked about all the good things it can do, and we've also talked about the scary things it can do, as well as like how it can help decrease the burdens and help people work to the top of their licenses. So we know there's oversight. We know all of these things, but everyone who's working there doesn't. So we have to explain why, so they won't get afraid and they can get excited about it, and show how you're going to be making sure you're monitoring it. Show that it's not going to take your job, that is going to make them easier and make you more excited to come to work every day. So we have to work on change management structures and educating people on why we're facing this with our organization. So we have some trainings with digital risk compliance solution. We can offer different types to help fit your learners' needs, because I think that's another thing, like making sure that you're ensuring that you are fitting the learner's style, because there are different types of learners, as we know. There are people who may be auditory, visual, they can read a SOP and be good. Some people need workshops that are hands-on, some people need courses. So fitting your organizational needs are important, as well as what the topic is. So there are different levels, because people who are engineers or your experienced people in your organization, they understand the reason why or how things a little differently than people who are on the clinical team, maybe a medical assistant or a nurse or a doctor. So figuring out how to speak their language and teach according to their needs is important.
Wow. That was amazing, Doctor. You really touched the necessary part I wanted to ask you more questions on. So you really made me speechless. So I believe that the audience really was enlightened, on that question, on that answer you dropped right there. Thank you so much for sharing that. So we've come to the last question for you. You've been an amazing guest speaker, Dr. DeRouen. So we have the last question for you. So the last question goes this way. How do you see the impact of new technologies such as AI and machine learning on compliance and efficiency? I think we've
Mhm.
shared some insights on that. So could you just, in a nutshell, just tell us more about that question?
Yeah, I agree. We talked a lot about it. I'll just mention a couple of things. I think that it's not new. So we've already been seeing the tremendous growth over the past decade or more of utilizing machine learning and now artificial intelligence that are kind of have that human aspect, that we're giving tools and resources in order to take in information and disseminate it and to optimize these workflows. So we know that it's looking for scrutiny and oversight, which is exciting. So like the policies that are coming out will help us shape the future of AI. We've seen also some scary tools. So we know that a digital tool is only as good as the humans that program it. So we must ensure that we're not in programming in bias or things that can worsen patient outcomes or perpetuate like inequities and lead to more headaches than efficiencies. So we've seen, for example, in the news, United Healthcare in the headline where they have been using AI to deny claims that should have been approved. So 90% of the cases that when you looked with a human should have been like a yes, the patient deserves this, they had 90% saying no. So that has led to some lawsuits. So we know that AI can improve efficiency, which it denied them very quickly. But we have to make sure that we're programming it and using it for good things. So we know that AI has the promise to streamline administrative tasks, reduce time, resource expenditure, enhance like the diagnostic accuracy, like we said, or treatment personalization, and improve patient outcomes. And it can like identify some of these red flags that are going on, where we can analyze large data sets very quickly and do that data analytics that you were mentioning and support like this data driven, evidence based medicine, which can lead to more effective management and resource allocation. So there are so many promises that AI brings, but we just have to realize we're in this stage where it's been around for a while, but we're from infancy to toddlerhood. Like when we get to the toddler stage in life, like they call it like the terrible twos and the all of those things. So we're at that point where we're going to have to work on setting boundaries, regulation, and like really watching them so it won't just run off in the playground.
Wow. Dr. DeRouen, you're an amazing personality. You've been an amazing guest speaker, and you've come to the end of the session. Before we wrap up the session, what are your last words for the audience?
I appreciate you inviting me here. I think that this is amazing that you're using your platform to educate people about all of the different things that are going on in healthcare. I just want to leave this for everyone who is interested in healthcare. Please learn about the new tools that are out there. They're not something to be afraid of. They really are like the next frontier. I know it seems like cheesy, but we're moving into the next frontier of healthcare. So it's important to learn about them, learn how to leverage them, learn how to keep your patients safe. And if you're a healthcare organization that's learning how to navigate your risks, definitely reach out to Digital Risk Compliance Solutions. It's just as I just said it. That's the name of the website, www.digitalriskcompliancesolutions.com. Or if you want to reach out to me and have a conversation, you can definitely reach out on my LinkedIn. Um, it's my name, Erkeda DeRouen, DRKEA, last name DEROUEN. We can have a conversation. I appreciate you for inviting me.
Yeah, thank you so much, Dr. DeRouen. We've come to the end of the session. So if you love this content, do to subscribe, like, and share to your network, and wait for my upcoming videos as well. Thank you so much.